Good morning, Crystal. How are you? If you could talk.
How does it work? Oh, hey.
Hey, good morning. How are you?
Good morning. It's great. How are you?
Oh, I'm just going live. I got a few minutes, and I thought I'd jump on here see if anybody have any questions. You have
Cool.
any?
The last time this didn't work. The interactive part didn't work.
Yeah, last time I picked. There's two settings on our app, and one of them is it's like for a webinar where you can have like up to 1,000 people on it, and then
Yeah, that's
the other
cool.
setting is it limits how many people you can have on it. Like it only lets 15 people join this session. And so this time I selected the smaller one, but the smaller one's interactive. Like you can ask questions and stuff like that. So I'm gonna
So,
I'm gonna start doing that
does
kind of stuff.
does
But
the view what do I see? I just see whoever's talking.
yeah, like, and that's what I'm seeing. Like when you talk, my picture goes down, and then when you talk, you come on and I go away. So
All right, that's cool. I love
it's
it.
kind of cool.
Well,
So
I'm gonna actually put you on mute because I will be listening while I go drop my kids to school, and then I will
yeah.
be in clinic shortly. So
Oh,
I want
perfect.
to hear and listen. I
Awesome.
actually have my very first dissolving lips today, so that's really
Yeah.
exciting for me.
Well, I'll tell you what. While you put me on mute, I'll talk about my techniques, how I do that.
Oh, I
Uh,
love it. Okay, I'm
that'd
gonna
be
put you
that'd
on
be
mute now, and I'll listen.
Yeah, perfect. Awesome. Yeah, so we do a lot of dissolving in my practice. In fact, Allison, and I'm going to throw her under the bus here because I can, because she's my employee, and she's pretty much given me permission to talk about her. But Allison came in this last week, and she got her lips dissolved. And I recommend, especially with the lips, I recommend dissolving every 2 to 3 years, especially if patients are constantly come in. And we were looking over Allison's history, and it had been like 3 or 4. What tends to happen with especially with lip filler or filler in movable areas is it tends to migrate. And when it migrates, it starts giving you weird stuff. So if you see patients with like a little crease right here on the corners of their mouth, or you see a little bulge like right here, it typically bulges up like right here, or they get that little duck lip. It's probably time to start dissolving. Okay. I use Hylenex in my practice. It comes in little vials. You can buy it on our store. It works really really well. And Hylenex is a hyaluronidase, meaning it's an enzyme that breaks down hyaluronic acid. It is a product that they use human tissue, or it's a human-based product, kind of like albumin. Like albumin is harvested from humans. Hyaluronidase is harvested from humans. And anytime you have a product that comes from a human origin source, you have to test it with the patient to make sure they don't react to it. About 1 in 2,000 people will react to hyaluronidase. Like when I say react, like a full-blown allergic reaction. And so, anytime you do a filler dissolve, the first step is you get an insulin needle, that you use for tox, and you draw up just a little bit of hyaluronidase, like 2 or 3. Like I just take it to the 5 line. So about 5 units of that hyaluronidase. And then what I'll do, just like you did in nursing school with tuberculin syringes, is I'll just get on the forearm and I take that little needle and I go right under the skin and make a bleb. Okay. You don't want to go too deep because then you can't see the bleb and it gets in the tissue, but you just want to be right in that epidermis and that dermis. And the very first thing I'll do when they come in is I'll just say, hey, I got to do a test, make sure this product works for you. And then I'll just put that in and I'll make a little bleb. And I'll mark that bleb. If I can't see where the needle poke was, I'll just put a little black dot there on that bleb. And then while that bleb's sitting, I sit and I talk to them and I tell them about the procedure, and that will I'll talk to them about what this does and how it usually takes multiple treatments on how to completely dissolve that filler, and go over consents and stuff like that, and talk to them about it. And then usually by the time I'm done with that, it's been 5 minutes or so, and I can start to see if they have a reaction. Now, I've never had a patient have a reaction to it, but 1 out of 2,000 doesn't sound like it's that rare. However, when you multiply that by 300 million people, you've got several million people in the United States that will react to it. So that's why we have to test it. That's why we have to test Hylenex before you inject. Now, I only do that once. Like if I've tested it once, then I never test it again on a patient. I know it's going to work, and I'm not too worried about it, right? so once I identify that they're not going to react to this stuff, then what do? I go into my room and I prepare the solution. And what I like to prepare my solution is I don't just inject straight Hylenex. I mix it in with a little bit of bacteriostatic saline and a little bit of lidocaine. Now, Hylenex will burn like hell, and lidocaine's a little acidic as well. So the lidocaine's just to make it a little bit more comfortable. Numb the area up prior. I usually just do topical. I'm not
I'm
doing.
not doing.
We're getting a little bit of feedback on your crystal. If you can, if you can mute your.
I can hear you. Sorry about that. I wanted to ask you before you move on, what's your concentration ratio if you're adding lidocaine and bacteriostatic saline to vial Hylenex?
Gotcha. Yeah, I was just going to get into that. Good question.
Oh,
So
sorry.
what we
Okay.
so yeah, no problem. What I'll do is I will take one vial of Hylenex. That's 1 milliliter. That contains 150 units of Hylenex, and then I will mix in about a half a cc of lidocaine. And then I will also mix in about 1 cc of bacteriostatic saline. You could do 2 cc's if you want. But I like my final concentration to be about 2.5 to 3 cc's. So just a little bit of lidocaine, 1 mil of Hylenex, and then I do the rest bacteriostatic saline. And I do it in a 3 cc syringe. Then I'll put a 30 gauge needle on, and I will inject the areas that I want dissolved. Now, when you're doing lips, inject some in the vermilion, but really important, also inject above the vermilion because that's where the migration happens. So what I'll do is I'll go right in at the vermilion border, and then the first thing I'll do is I'll tilt my needle into the vermilion, and I'll just lay one bead right in the middle of vermilion, and then I'll go down and I'll go up above the vermilion, and then I'll leave a bead right above the vermilion. Okay, and then I'll go to the other side and do the same thing. Okay, and so basically through 4 or 5 injection points, I'm just laying bead because it's pure liquid. It's not like filler where it's very precise. It's gonna stick where you stay. It's gonna flow. And then I just put that 2.5, 3 cc's all around their mouth. They're gonna be very swollen. First of all, you're putting 3 cc's in lips. It's gonna get very puffy. It's gonna get very diffuse, and it's just gonna go over everywhere and start dissolving that filler. And then as soon as I'm done, I'll rub it in. And what's really interesting is you can actually watch that filler dissolve like almost instantaneously. But you're never going to get it in the first try. It usually almost always takes at least 2, sometimes 3. If it's been like 5, 6 years and they've just done filler, there's a lot of filler in there. And So you got to dissolve it out. So I'll have them come back the next week and look at it, see if we're doing okay. Hyaluronidase has a really half-life. It's going to be in and out of the system in probably a day or two, and but you don't want to put filler back in there immediately because if there's any left over, you're going to destroy the filler that you got. And so I was trained to wait 2 weeks after hyaluronidase treatment. Allison was in town and we filled her the next week. Like we were really aggressive, and we put filler in her the next week, and everything worked out really, really well. And cost wise with that, I think a vial of hyaluronidase, you buy a pack of 4 for like $300. So each one of those vials is $75. I charge $100 for a dissolving treatment. I'm not trying to make money on them. I'm just trying to cover my costs, so they do it so I can get more natural results. And what you're going to find is, and I might talk about this in the training. I don't know, but this is what I talk to my patients about. Is I said, when you come in with, when you want like lip filler, you have an empty bucket. And what I'm going to do with your first treatment is I'm going to fill that bucket up. Okay. And then over time, that bucket's going to slowly go down. But patients don't wait till the bucket's empty again. They're going to wait till the bucket's, let's say, half empty. And then what am I going to do? Well, I could do a mini lip and fill the bucket back up, or I can do a full lip and maybe kind of get a little bit more than the bucket. All right, which is okay, And so now you have more lips. And then what's going to happen? They're going to be used to that bigger bucket, and it's going to go down. but they're not going to let it go all the way to empty again. They're going to let it go to like maybe 3/4 of the size, and they're going to fill. And so, anyways, you get my point. We tend to overfill with multiple treatments, and then that's what pushes the filler out into the areas we don't want it. And so that's why it's a really good protocol if you want natural looking lips to do it every 2 to 3 years, and that's worked really really well in my practice. So that's how I charge for it. It's a really easy treatment to do. 15 minutes. Honestly, the hardest part of it is the psychological realization that these patients have that they're not going to have lips for a few days, because they're used to this, and then boom, it's gone, and they go back to the way they were. But it also lets them know, holy shit, look what this provider's done for me. This is how my lips used to be, because you forget. And they're like, wow, look how I want my lips back. And then they're going to keep coming back to you. So you will also there will be times when patients come in, especially as you get more experience, where you're like, I don't want to put any more lip filler in you. And that's a really hard thing for patients to hear. Like, ooh, like I go, and I had this conversation last week with the patient. They came in and they go, I want more lip filler. And I go, do you want to look fake? And they go, no. And then I go, then don't do it. I go, let's dissolve and do it naturally. And she's like, oh, but I just want them a little bit bigger. I go, I can get you big again. But if I do filler on you, you will look fake. Are you okay looking fake? And if you put it like that, oftentimes they will do it. Now, I've had other patients in the past say, oh, yeah, I want to look fake. Okay. Well, if you want to look fake, I'll make you look fake. But that's what they want. They want that big, exaggerated lip. Okay. Now, that's few. That's like 1 out of every 40, 50 patients. So most patients want to look natural. Most patients want to look good. And so that's why lip dissolving is so important. So I hope that answers your question, Crystal. Let's see who else we got on here. Angelina, what kind of questions do you have today? It's just two people on. If you have any, if you don't have any, that's great. We'll wrap this up, and we'll talk again next week. So real quick, because I'm in my office and I saw this, and this is what I was going to talk about today. And you guys don't know this. I have two clinical locations, or you might know this. I have two clinical locations. One clinical location I do hair. The other clinical location I do all my injectables and machines and stuff like that. But in my hair clinic, in my back room, I have a centrifuge, and this is the centrifuge I like. It's called the Duo Quattro. And then the new ones, this isn't plugged in right now, but the new ones have different settings for you. IPRF is what you're going to do for most of what you're going to do in practice. These are under IPRF or PRF for the hair. But this one's nice because it has an F and an M. F is female, M is male. And male, you spin down a little bit more than female. Why? Because there's more hemoglobin and there's more red blood cells in a male patient than there is in a female patient. So the female patient runs about a minute slower than the male patient. So this is a really nice thing. You just turn the dial, you get it up to IPRF male, and to get your male injectables, and IPRF female for your female injectables. And that's what I like about this one. It's a quiet machine. It's really quick. I can run PRF in about 5 minutes, which is really, really nice. APRF is if you want a clot. This is what like dentistry uses. They'll get a clot out, and then it's like a suturable material, and they'll like go into their surgical site and they'll inject it. I've never used APRF in my practice for hair and hair restoration. So if you want a good centrifuge, these are the ones to get. The Duo Quattro. I think I got mine from prfprocess.com, which is a really, really cool, good centrifuge. So sorry, this is like reversal. So all those letters were backwards because I'm using my camera on my phone. But anyways, if you guys need a good PRF centrifuge, that's what I did. I don't buy their test tubes. You can from them. They're okay price wise. I can't remember off the top of my head, $20-$30 a patient. But what I do is I get test tubes from Boca Dental Supply, BOCA Dental, Boca Dental Supply, and they have a test tube that's just empty test tube. Sterile, but there's no ingredients in there. They come in these little yellow test tubes, and that's where I get them from. They're kind of a pain in the ass to work with. They don't have really good customer service at Boca Dental, and my team's always complaining about how they are always playing phone tag with them to order process and stuff like that. But that's where I get my test tubes. They're like a pack of 2 test tubes, like $5-6, something like that. So it's really, really inexpensive to run PRF if you use their test tubes. So, but that's a little hack as well. So, all right. Well, thanks for jumping on and listening. We'll obviously post this recording. And oh, we got a chat message. Oh, her speaker isn't working. Angelina says, launching lip soons. I feel like I can't pull the trigger even after trainings. Advice and techniques. Thank you. I say this in my training, or at least I think I do. Lip filler, any kind of filler, is art. And the only way you get good at art is you paint a lot of freaking pictures. And you just got to start slow. And if you want to start off on the safe side, just do a mini lip. Go in right at the vermilion border, right below in the vermilion. You don't want to be on the vermilion border. You want to be just either, if you're doing the top lip, inferior to the middle to the vermilion border. If you're doing the bottom lip, superior to the vermilion border. And just put a little bead right against that vermilion border all the way around the lips. You can't go wrong. If you do that, it's simple, it's easy, it's not painful, and you just do a little half a cc or 0.75 cc's of filler right along the vermilion border. And just if you want a little cupid's bow, my lips are horrible because I got all this facial hair. Just you go down and just pull up, you turn your needle and just work the lips just like you saw on the thing. And you just got to do it. The best place to do it on a family member. Dive in, do it on a family member. They're going to be very grace. They'll give you a lot of grace, but it's not going to ruin a lips. And if it does, guess what? Filler is reversible. Say, hey, I really screwed up on those lips. Let's just dissolve them out and come back next week and I'll do it again. And people understand that. People understand that you're learning and that you're giving them a deal and things happen. I've never had a person complain about a mistake I make. Never. Because I'll make it right. So you just got to get started and get over your insecurities and your fears. When we think about these things, we tend to go down the negative rabbit holes, which is like, oh my gosh, what if this happens? What if that happens? What if that happens? What if that happens? What if that happens? Do I want to do it? You got to get over it. You just got to start doing it. The only way you get on the only way to progress on your journey is to take the first step. So just do it. And you will practice, and that's how I learned. I mean, when I got trained on filler, I think I've told this to you in my training or in some of my training classes. I got the worst training ever. I didn't even get hands-on with patients with filler, and so I had to learn it on my own. And I'm like, okay, well, let's do it. So you start practicing on people. And then every time you practice, you get better and better and better. And then you become an artist. And then you're painting these beautiful pictures. So you just got to start doing it. So start small. Just do mini lips. That's a great way of doing it. Just do mini lips and get going. So hope that helps you, Angelina. All right. That's it for today. Thanks for joining. We'll post this video. And we will see you next time. Have a good day.